Well, hello everyone. Welcome to the AADA-AMCD practice brief. I am Dr. Jillian Blueford, one of the task force members. And today I am joined by Dr. Charmaine Connor, who is Assistant Professor of Counselor Education at Roosevelt University. Charmaine, thank you so much for joining me today.
Yes, I am glad to be here. Really excited to talk about this.
Yes, likewise. And so I will just jump in with the first question. We'll go from there. So describe the value of multiculturalism in the work that you do.
Well, when I saw this question, I actually went back and I wanted to find a couple of definitions of multiculturalism to see how I wanted to frame my answer. And I think the value of multiculturalism in the work that I do, I am working to make sure that people in traditionally marginalized populations that their voices are heard. And I also am working to challenge the perspective of people who are traditionally privileged. And so the ways in which I do that and the value comes in through my research. So my dissertation was on the experiences of Black transracially adopted families. And in that, I wanted to bring awareness to transracial adoption. It's something that we
Mm,
don't know much about in counseling. We aren't trained to work with families who have transracially adopted children. And specifically in the literature, Black transracially adopted children's voices have been minimized.
mm,
So I believe that it's important for me to help bring awareness to that in a way that doesn't make me be the focal point, but make their voices be heard. In my service, serving on the Minority Fellowship Program Advisory Council for MBCC, having an opportunity to service mentees, helping them to help their clients. So indirectly providing social justice in mental health through getting counseling,
right.
in teaching and supervision, being making sure that I'm having inclusive examples that I use, highlighting the works of Black, Indigenous, and people of color counselor educators and counselors in the field. And then in my own counseling services, making sure that I'm servicing clients in traditionally marginalized populations and letting their voices be heard, honoring their experiences. So that I believe there's a lot of value in all those five pillars, and that's what I'm always motivated to do.
Yeah, and I'm seeing a theme of how can you best amplify voices that are traditionally go unheard, minimized, invalidated, and really, create platforms to amplify those voices.
Yes. Hmm.
Right. And you spoke a little bit about social justice, and so continuing on, like, how do you fit social justice into your work?
Well, I recently had this conversation with my students. I believe there is social justice in seeking to be mentally healthy.
Mm,
And so it is important that people get the mental health they deserve. They seek to get their needs met. And I guess it would really tie back into question one, how I do that in my research, service, teaching, and supervision. Also work with my specific population. So I have a specialty in play therapy and making sure that I'm amplifying the voices of Black and Brown children in play
mm,
therapy,
mhm.
providing services, doing research, helping parents understand a different way of
Right.
engaging with their child that acknowledges their feelings and promotes mental health in children.
Mm, mhm.
Also, using play therapy to service the transracial adoption population. So, I want to be clear here I am not a transracial adoptee. And I do also want to explain what transracial adoption is. It is
Yeah.
the adoption of parents, they adopt a child who is of a different race than themselves. And so I came about working with this population because at the time I was the only Black person working in our counseling clinic at the
Mm,
university I was at. And this specific parent wanted a Black play therapist to work with her child. I didn't know that the parent was white because we had a phone conversation
right.
initially. And so when I met with this parent, I remember thinking, okay, so I know there has to be a term for this, but I've never heard it before. I was never
Mm,
trained on it. And so I went and did a Google search, and lo and behold, transracial adoption. And I had to do a lot of reading, and watching videos and gaining a deeper understanding of what it meant to be a transracial adoptee and how to work with them clinically, I sought out a mentor who is a transracially adopted counselor educator. And so we've been working together on different projects to amplify their voices. And then also working within my own population. I am always committed to making sure that my Black clients and Black people in general are seeking to get their social justice through mental health.
Mm-hmm. Yeah, and I appreciate that while you didn't get the training and you didn't know quite what was happening when you met with this parent, you said, I need to do some homework, right? I need to learn about this, and that has, transpired into your work, and hopefully future work in this area. But it's more of like, it's on me to know what's going to be best for my clients, and if that means I need to do some more homework and figure out what's going on, then I'm going to do so.
Yeah, definitely. Which has led to me wanting to make sure that we have adoption competencies in every class that I teach.
Right.
Because a lot of people don't know there are adoption competencies that have been endorsed by ACA.
Yeah. Yeah,
Hmm.
absolutely. So yeah, it's um, going out and saying, hey, there's not a lot that we know about, and how can we fix that by teaching the students now, and
Yeah.
future counselors.
Yes. Hmm.
Great. So when you think about the lifespan, and so I imagine, in your work as a play therapist, obviously you work with younger clients, but their families are involved as well. And so I'm sure you have seen and worked with individuals of all ages.
Hmm.
What's important to you when you're considering the lifespan development in your work?
Well, what's most important to me, especially from a play therapy perspective, is normalizing some of the children's behaviors. I get a lot of referrals about parents coming to me and saying, my 4-year-old has ADHD. My response to that is, every 4-year-old has ADHD.
Yes.
So just that basic understanding of child development is so important because when it normalizes some of the experiences that parents go through.
Mm,
Also, I incorporate a lot of trauma informed work into play therapy. So when I'm working with my Black clients, my Indigenous clients, my clients of color, I'm making sure that I'm talking with parents about how trauma impacts the developmental process.
mm, mhm.
Because when trauma occurs for us, I don't want to say we get stuck, but there's a moment in our development that has a rupture.
Mm,
And
mhm.
until that trauma is worked through, it can be difficult for the child to advance into other developmental stages, especially regarding emotional development. So that's how I use it with my child clients. I also It provides understanding for parents, teachers, administrators who are working with children and adolescents, just normalizing some of the things that they are seeing. That's
Mhm.
normal behavior. And yet it may not feel normal to you. So then we talk about their own development. What
Yeah.
was it like for you as a child? Can you step back into those shoes and
Mm,
figure out what you felt, what you needed from adults? When
mhm.
working with my young and middle age adults, it helps to reduce the comparisons that they make to other people in their age group. So,
Right.
working with a lot of 20-year-olds, they like to say, well, my friend has a full time job and they're making all of this money and I'm not doing that. And so, helping them understand that everyone's in a different place, especially in your 20s.
Mhm.
Everyone's trying to figure things out. And so, I think the overarching thing for me is just normalizing things, but then also highlighting some of the differences regarding the racial differences that are in development, the emotional differences that we
Mhm.
have because of the trauma that's shown up in our life. All of these different things also play into development.
Right. Yeah. So considering a lot of moving parts, and also normalizing and helping, it seems like adults go back into their childhood and say, it looks different for you now, but when you were a kid, like, did you also have these same experiences, and where, infusing trauma informed care in that, and trying to like better understand, it seems like, the overall development, and how to
Hmm.
best support everyone of where they are at this point in their life, knowing that like you probably are where you should be.
Yes. Hmm. And also helping parents expand their own feelings vocabulary. A lot of
Mm,
parents that I encounter simply want an action to be done,
mm,
um, but not really highlighting some of the feelings that might be going on behind the child not doing what they want them to do. And that's a hard thing to rework for some parents.
right. Yeah, I imagine. Imagine. So my last question for you is just, what are some concrete examples that demonstrate how you incorporate multiculturalism, social justice, lifespan considerations, maybe in your role as a counselor, educator,
Yeah.
supervisor, researcher, all the many hats that I'm sure that you wear?
I'm going to come from a counseling perspective here. I have two experiences that I want to highlight. One was when I was working as a play therapist in a school. So I'm not a school counselor. I want to be clear about that. But I have provided play therapy in schools to children who have
Mm-hmm.
been specifically for this particular experience. These children had been labeled as aggressive in the school. And my entire caseload were Black and Brown children
Mm-hmm.
at that time. And there was an incident that occurred where I was going to pick a child up from their class. They had just come in from recess. And as I turned the corner, I hear the teacher berating my client.
Mm-hmm.
And he was a 9-year-old Black boy. And the teacher accused him of hitting another child. My client was adamant that he had not hit another child. The teacher was out of control. The teacher called him stupid,
Wow.
and she was about to call him the N word.
Wow.
And I tapped the teacher on the shoulder and said, "You and I need to have a
Yeah.
conversation." I asked my client to go sit in the room until after I got done speaking with this teacher. And I told his teacher that you're out of control.
Mm-hmm.
You were about to say this word.
Yeah.
The teacher took responsibility for her actions in a very minimal way.
Mm-hmm.
Yes, I was going to say the word, but it was a but there. But
Mm-hmm.
he hit someone. That it doesn't matter if he hit someone or not. You can't say that word to a child. You can't say that word to anyone.
Right.
The teacher was also white, so you definitely cannot say that word.
Mm-hmm.
And then I told her I'm going to take the child and that I would be reporting her to the school counselor. So I took the child to the play therapy session. We did it. When we came back, it was revealed that he did not hit the other child. Someone else did.
Mm-hmm.
And so I advocated for my client by telling the teacher, you owe him an apology.
Yeah. Absolutely.
You owe him an apology. You were wrong and he was not. And she did apologize. It did not appear to be genuine, but we won't go there. And then I went and I did report the teacher to the school counselor. And from what I understand, the consequence was that she needed to get some training in multicultural work.
Mm-hmm.
But there was no other kind of
Right.
consequence there, at least not said to me. So that was one of the incidences in where it was always important to me when working in the school setting to advocate for my clients who were primarily Black and Brown children, because that was just one semester that was the caseload only Black and Brown. But then
Mm-hmm.
across the 3 years that I was there, I had kids of all racial demographics. But advocating for them and really debunking this idea that Black boys are aggressive and that Black girls are loud and disrespectful and
Mm-hmm.
out of control. And so
Yeah.
that was really important to me.
Yeah, absolutely. And so, one, thank you for advocating for that student and noticing it and calling it out and calling for what it for what it was. And I can't imagine, unfortunately, how many other times maybe you've had to do that in your work in the
Mhm.
school settings and just also in clinical work and in all spaces.
Yes. Yes, it's difficult. I will also say the other example is when working with two adult clients. These are two separate adults, two separate occasions, but one client used the word mulatto in session,
Mm-hmm.
and then another client used the N word in session. And so I had conversations with them about how those words are a microaggression, especially using them in session while I'm present, and
Mm-hmm.
explaining the implications of that. The person who used the word mulatto tried to convince me that it was simply a term that was okay during her time growing up. And I reflected back to the client, you are no longer a teenager, you're 67 years old, and that term is no longer appropriate.
Yeah. Yeah.
Mm-hmm. And with the client who used the N word, She was very aware of what she was doing, but she was using it as a means to deflect from some of her own issues.
Mm,
But educating her on how, well, when I hear that word in this session, I can't promise you that my mind won't go in a different place. I'm going to try and remain present. I want you to
mm-hmm.
understand what that means for me as a Black woman.
Right.
I can't tell you what you can and cannot say, but I can tell you that I received that disrespectfully, and it may take me a moment to show back up and to be
Mm,
present in the
mm-hmm.
session. We ended up working through that. After about 4 more weeks, the client eventually stopped using the word, but advocating for myself, but then also advocating for people who are not in the room is important to
Mm,
me.
mm-hmm. Yeah, and I just a follow-up question to that. Um, I imagine for students, new professionals who may feel hesitant to bring that up to their clients, to call it for what it is, to acknowledge what's going on with them in the session when clients are using those words. Like, have you always been able to confront your clients with that, or what was kind of the breaking point that you're like, I need to say something?
I think it was a personal journey that I was going through. I can't say that I always did. All of these examples happened years ago. So I would say in the last 5 years, I've gained a lot of confidence in challenging clients when things like that occur. Prior to that, I probably was in the same space as a lot of new students and new professionals where I froze and felt like I
Mm,
couldn't say anything. But like I said, I was going through a personal journey, which kind of bled over into my professional journey,
mhm.
for where I have boundaries,
Right.
and being able to establish those boundaries with people, that's important. I don't allow myself to get mistreated. I'm going to call you out. I'm going to challenge you. I will share with the viewers that I won't pretend that it's an easy thing.
Mm,
It's not. I still have all of the anxiety that comes up with confrontation. I still feel it in my tummy. I feel it in my chest. I feel it in my head. But it's not worth me being authentic and being
mhm,
genuine, or losing out on those opportunities to be authentic and genuine. A lot of people want to know how we're going to work through some of the issues in this country regarding race. I think it's going to take some courage to be honest with people about how they have offended you. It is their responsibility to know and understand. I want to make that clear.
right.
But I also, if I'm going to hold you accountable, then I believe I have a responsibility to communicate, hey, this isn't okay.
Mm, mhm. Yeah,
And so
absolutely.
I have to work past that anxiety, and I say it. So I think Nike said, just do it.
Yeah,
Just give it
absolutely.
a try.
Yeah. Well, Dr. Connor, thank you so much for chatting with me, sharing your experiences, your work, and
Mhm.
I'm sure our viewers will appreciate all that you're doing for our field, for just everyone, honestly, in your communities and around this country. So thank you.
Thank you. It has been a pleasure to share these experiences and thoughts with you. So I'm excited for the
Yeah.
viewers to see this.